Alright guys, so welcome back. In this video we'll be discussing about Parkinson's disease. Now this Parkinson's disease, this is actually a basal ganglia disorder. So we'll be discussing one by one that what it is. So this is a progressive basal ganglia disorder which typically affects the movement. So this is a movement disorder. So we'll be discussing that what are the signs symptoms which are seen. So let us begin. This Parkinson's disease is a neurodegenerative disorder that affects predominantly the dopamine producing dopaminergic neurons in the substantia nigra of the basal ganglia. So what is this actually? We can see here in this diagram, we can see the substantia nigra, and what is happening here is that there is degeneration of the dopaminergic neurons in the nigrostriatal pathway. So this basically gets degenerated. There is another video here. We can see that this substantia nigra, now this is releasing less amount of dopamine. Normally a good amount of dopamine is released. Now here there is degeneration of this dopamine, so there is less amount of dopamine which is released from the substantia nigra. So this will actually affect what? This will cause loss of dopaminergic neurons in the substantia nigra, and this will ultimately lead to an imbalanced final output of the basal ganglia. So the basal ganglia, the indirect circuit will be affected. So what will happen here is that the fine tuning movement of the basal ganglia, this planning and programming, this will be affected. So we can see here that the D1 dopaminergic neurons, there is degeneration, so there is less amount. So the final output of the indirect pathway of basal ganglia, that is affected. So this patient will start having like tremors, and all these movement disorders will be seen. So the clinical features here are the tremors, rigidity, akinesia and postural instability. So we can remember this as TRAP, a mnemonic like TRAP. Okay. So these are the mnemonics. Now one by one we'll be discussing that what is tremors. Okay. So tremors will be like, when we discuss here, tremors is actually a shaking or which usually begins in the limb, often the hands and fingers. So there will be a frequency of 4 to 6 cycles per second, and we will see here that these are the resting tremors, and what we see here is that the hands may tremble when we see at rest. We can see the resting tremor here. So this is very much important to distinguish with the cerebellar lesion tremors. Okay, in cerebellar lesions, what happens that the tremors are intentional, and in Parkinson's disease the tremors are resting. Okay, so here we have discussed. Now in this video also we can see that these are the typical pill rolling tremors. So pill rolling is like, it is rolling like a pill. The patient may rub their thumb and forefinger back and forth, knowing as a pill rolling tremor. And this is another case which we can see the resting tremors here. The hand may tremble when it's at rest. So these are the resting tremors. We can see there is slight tremors here. So we have discussed about these resting tremors. Now we'll be discussing about the next thing. This is another case of the resting tremor. Okay, so apart from these, what we see the resting tremors in the hands and feet, we also notice resting tremors like many other different sites of tremors. One of the tremors is like it is seen in the tongue, it is seen in the mouth. Okay, there are also head. There is constant movement of the head. Okay, so the patient has a very tough time with Parkinson's disease. Okay, so these are all produced due to lack of dopamine. Okay, so we have discussed this. Now another thing which I would like to discuss here is about the bradykinesia or the akinesia. So what is bradykinesia or akinesia? This is slowed movement. That means that there is slowing of movement which makes the simple task difficult and time consuming. So here you can see that there is difficulty in starting the movement, and there is also difficulty in stopping the movement. So bradykinesia or akinesia means the patient is having a tough time in starting the movement and stopping the movement. And also the gait, which is very much important, is the shuffling gait. Okay, so we can see here that the patient is taking small steps. Okay, so this is actually a typical shuffling gait, and his body is bended towards the center of gravity. Why? Because it is due to the rigidity of the muscles. So in order to avoid the fall towards the ground, the patient has to take small steps, and he walks like this. So this is another patient here. So this is the shuffling gait which we see here. This refers to quick stepping and short stride walking movement. So we have seen two cases of shuffling gait. Now we'll be discussing about what is rigidity. Okay. Now we see the case of muscle rigidity. Okay. So this is a typical case. We can see the muscles are rigid. Okay. He is having a stooped posture. The muscles are rigid. So this occurs due to hypertonia. There is an increase in the tone, and this is a very important feature. This is the cogwheel rigidity. Okay. So lead pipe and cogwheel both are seen. We can see here the cogwheel rigidity. So when the examiner is moving the wrist joint, it moves in a cogwheel resistance pattern. So this resistance is seen as a cogwheel. And another feature very much important is about the mask-like face. So we can see that there is expression-less face. That means there is no expression. The patient's face appears to be like a mask. Okay. So this is a typical feature of Parkinsonism. It appears like a mask-like face. Okay. It looks like he is wearing a mask or something, with no expressions of the facial muscles. So this is the boxing legend, late Muhammad Ali. So we all know that he had Parkinsonism, and he had a very tough time with Parkinsonism. So in this photograph, you can see that he is having Parkinson's disease. We can see that there is no facial expressions. So this appears to be a mask-like face, and this is the before and after pic of Muhammad Ali. So what happened here is that we can see three features actually. The first feature is about the mask-like face. The second is rigidity of the arms. Okay, we can see rigidity. We can also see stooped posture. So this is basal ganglia. Whenever the substantia nigra will be affected, this will ultimately cause hypertonia, rigidity, mask-like face. These are all the features. Okay, so now coming to the treatment here, the treatment part is we have to increase the dopamine level because there is degeneration of dopamine. So we will give levodopa plus carbidopa. This is the first line of treatment. And then is the benztropine and trihexyphenidyl. Now these are anticholinergic drugs which are used to treat tremors. So if you want to reduce the tremors, we will give benztropine and trihexyphenidyl. Okay, this will reduce the tremors. Now, if suppose medications are not useful, then we will go for deep brain stimulation. So we will try to stimulate the basal ganglia. We will give deep brain stimulation. So this can also reduce many rigidity and these all things. Now the most important thing here is about the lifestyle changes. So the patient should be able to manage stress. We have to cooperate with them. Remember that worry, anxiety, fatigue, illness, these will make tremors worse. So we have to give certain relaxation techniques, and always remember that love, kindness, motivation, we have to encourage these people. We have to go and find these people and encourage. We have to show empathy towards them. So remember that the more love and kindness and motivation we show, the more the dopamine level rise will be there in the Parkinson's patient. So this was all about Parkinsonism. I hope that this video was useful. Okay, so share it with your friends and families. Make sure that anyone who is suffering from Parkinsonism, they need lot of love, affection, motivation, and reach out to them and help them. Okay guys, this was all about Parkinsonism. Thanks for watching.